Welcome to Getting Started on your pre-health track. Today we are talking about earning clinical hours and volunteer hours for the medical, dental, optometry, pharmacy, podiatry, and veterinary tracks. First, we'll start by defining what clinical hours are. So I like to use the metaphor of a rectangle and a square for this. Our rectangle is going to be healthcare experience. This is going to be any type of experience you are doing in a clinical setting, either indirectly or directly with patients. So this can include delivering food, ambulating patients, taking blood, shadowing a doctor, right? Taking vitals, right? Whether it's direct or indirect healthcare experience. Now, our square, right, our patient care experience, you'll often hear this referred to as PCE, right? It is a square because all patient experience is healthcare experience, but not all healthcare experience is patient care experience. So patient care experience is going to be any type of directly provided patient care. So an example of like exclusively healthcare experience, right? Healthcare experience that is not patient care experience would be shadowing, right? Doctors or dentists, right? Any kind of like volunteering, with, the exception of some exceptions for that, and kind of like general internships within the clinical space. Patient care experience roles, often these require some certification. Some really reliable PCE roles are certified nursing assistant, medical assistant, an EMT or an ERT, or phlebotomist. Sometimes in this PCE area, kind of walks the line would be like a medical scribe, an ABA therapist, pharmacy technician, or certain volunteer programs. Now, looking at clinical hour requirements by your kind of program of interest. For medical programs, both MD and DO, we recommend around 250 minimum hours, noting that applicants tend to have around 400 to 500 hours at the time of admission. So when they are admitted, when they start their program, around 400 to 500 hours. So being at that 250 kind of gets you on that track. Shadowing is good, right? Like 50 to 100 hours of shadowing, that's great, but we don't want all 250 hours to be shadowing. Taking some time to get some patient care experience, right? Work as a medical assistant, an EMT, right? Any of those things, strongly encouraged, but also just like general volunteer work, right? Anything where you're doing a little bit more than just kind of shadowing a physician is going to be good. For dental, here we say about 150 to 250, roughly 100 hours of shadowing, and then, an additional 100 to 200 hours of kind of just general clinical experience, both within the dental space and just within the general clinical world is actually okay. It doesn't all have to be specifically dental, but those shadowing hours should be specifically dentistry. For optometry, again, the same thing where we have some general clinical experience, 100 to 200 hours, but we're shooting for, roughly around 30 hours of directly shadowing an optometrist. For pharmacy, again, 100 to 200, like general clinical hours with, on average around like 60 shadowing hours of a pharmacist. And work as a pharmacy tech or a clerk is strongly encouraged if you are able to do that. For podiatry, generally, again, 100 to 200 hours. Shadowing, we tend to see around like 50 hours for competitive applicants. More is always better, right? But we're shooting for kind of around that. And then veterinary is very ranged. Most programs will say somewhere between 180 and 250 hours are required, right? This is program dependent. But most admitted students have, 1,500 hours or even more. So veterinary programs actually put a higher stress on your clinical hours that you have than on having like the perfect prerequisites, right? So just to say the clinical hours, they're important for all of these, right? But that really does stress them and hold them in a very, very high regard. And in fact, they also are really looking for general animal care experience outside of the specific clinical hours. So, if you're volunteering at a pet shelter or, working on, like a working farm or something like that, right? Or, something around, anything that's kind of working generally with animals, even if it's not in like a clinical setting specifically, is really encouraged if you're planning on going into veterinary sciences. Now, how do we go about securing these clinical hours, right? Volunteer programs are great, right? Looking at our COPE Health Scholars in our area, this is a really strong, healthy program. It's in a lot of the local hospitals. It gets you 30 hours of really in-depth training and then an additional 250 hours where you are rotating around each department at the hospital you're placed at. But lots of other local hospitals and community care centers have volunteer programs as well. How to get these clinical certifications if we are looking at, getting patient care experience. To go the EMT route, emstraining.emsa.california.gov is a great resource. I usually point students specifically to local community colleges to start off with. They tend to be highly affordable and they have high rates of accreditation. So it's a great place to start. And you can also check out the California Department of Public Health for a full list of accredited certification programs in the state. Also making sure that you are, attending career center events, looking at their job boards, right? They do host events with like local professionals. So, using those opportunities to connect with and build your network. And last but not least, focusing on opportunities to build your network outside of, school or the clinical space. On LinkedIn, you can access Fullerton's LinkedIn page, go to the alumni tab and look for alumni that are, maybe currently working in your field of interest, but who maybe are, in a program, right? In a PA program, in a medical program, in a dental program, right? That are doing that right now. Reach out to them, connect with them, hey, can I pick your brain for 20 to 30 minutes on how you navigated your path? I'm also a Titan and I'm, thinking about going into podiatry, right? Also joining on campus clubs. We have tons of health clubs, but any club on campus is a good way to make connections. As well as reaching out, to faculty, family, and friends. I'm recording this in November. There's a bunch of, school breaks and holidays coming up. And so, you may spend this time, when you're not in school around a lot of family. And, family tends to ask, what are you doing? What are your plans? What are you up to? Use that opportunity to tell them, hey, I'm really looking to get some clinical hours or I'm looking to volunteer more, You never know if Aunt Sharon's coworkers, you know, nephew works as, a medical assistant somewhere and, might be able to get you some hours there, connect you in some other way. So, I always say you don't know who's hiding in those, third and fourth degrees of separation that you might be able to, connect with and maybe get an opportunity. Another category in addition to your clinical hours that you really want to pay attention to is your extracurriculars, right? And this can be anything from research to, being part of an intramural soccer team to starting your own business, right? This is basically anything you're doing that is not clinical or academic, but it should reveal, right, your values, your passions, and also your leadership, your teamwork, your communication skills. Um, so research, definitely for these tracks, I would recommend, trying and dipping your toe into research. If you hate it, please don't continue with it, right? The whole purpose of activities in this category is to convey to an admissions committee what you are interested in, right? And through that, right, through what you've spent your time doing, what you'll likely continue to spend your time doing as a, pre-med, pre-dental student, as a practicing, doctor, dentist, optometrist, right? So if you spend all your time doing research, but you hate research. They're going to think you want to do research when you don't want to continue doing that, right? And so we don't want to tell them things about ourselves that aren't true. However, spending a year doing research does, demonstrate critical thinking skills. It makes you an informed consumer of research. So there's benefit to it. And if you like it, definitely continue forward. But if you don't feel like you have to. Getting involved in departmental research, talking with faculty in classes you take, looking at, faculty profiles on our departments, reaching out to them directly with a resume, and specifically stating why you want to be part of their research, right? Not just research in general, their research. If you, move on and you want to continue doing research maybe in a little bit more of a leadership capacity. Our undergraduate research center here, UROC, is great for getting students access to grants and funding and things like that, so they can continue their research. If you're part of a program like our honors program, or part of a major that offers an option for a thesis or a capstone, that's a great way to do some research as well. And also looking at summer research programs. A lot of universities have summer research programs that aren't limited to students from their school. So, definitely look into our programs. But if you aren't from around here and you go home over the summers, right, look into what your, nearby university does over the summer. See if there are programs you can apply to there. Also joining student organizations and clubs, the American Medical Student Association, Student Health Professions Association. We have the Pre-Dental Society. There's tons of health-related clubs on campus that you can join, but that's certainly not the only ones that you can join, and they're not the only ones of value. Also looking at joining, student leadership more broadly on campus or even within your department, as well as joining special interest groups, like culture clubs, ultimate frisbee, video game coding, right? Whatever, knitting club, right? Whatever it might be that you're interested in. Again, remember, like, these unique interests and values, right? They're useful in communicating, right, who you are, what you like, what you value. Along those lines, volunteering, you may be involved already in faith-based or general community groups, looking to take on additional leadership roles. If you're looking for places to get involved, idealist.org is a great resource for identifying nonprofit and NGO organizations working in, different categories or different topics that you can begin volunteering with. Um, as well as, don't negate any kind of part-time general work you're doing, right? Even working at the Habit, right, is giving you experience with, communicating with customers, sometimes difficult customers, working in high pressure situations. If you ever are onboarding new employees, that's leadership, right? So there's a lot you can get from seemingly unrelated work activities that are still really relevant to the skills that admissions committees are looking for in pre-health students, as well as your hobbies. Some of the most compelling applications I have read in the past few years have used their hobbies, be it dance or weightlifting or video game coding or, a lash extension business that they've owned, to talk about, who they are, what they value, how they see the world, and how that is aligned with their desire to go into a pre-health program. And the more that you can, kind of dissect what those fundamental aspects of yourself are. Why do you like knitting, but also want to be a surgeon, right? Maybe that one's kind of clear. Why do you love dance, but you also want to be a dentist, right? What are those things that you appreciate about both pathways? What does that say about you fundamentally? And how can you tie all of that together to create a compelling, cohesive narrative about why your specific track? Right. So sometimes I think looking at the things that seem unrelated and really thinking through, why do we like doing these things and what does it say about me, is the best place to start when you are looking at beginning to craft, your personal statement, your activities, your through line, your narrative of your application. So that is all we have for clinical and volunteer hours. If you are interested in learning more about academic requirements or the application timeline and process in general, you can find workshops with information on those topics on the advising page of the Health Professions website, the same place this was located. But I hope you learned a lot from the workshop and wish you the best on your pre-health path.